Good evening. It was 2 years ago this month that a 70-year-old man needed a doctor. He had a kidney complaint and he was in great pain. Now, the doctor's surgery is just 150 yards over there, and yet the doctor that came to treat him out of hours had come all the way from Germany. He was exhausted, he spoke very little English, and he killed Mr. Gray with a massive overdose of painkiller. Well, today, a coroner ruled that Mr. Gray was unlawfully killed and that his death amounted to gross negligence and manslaughter. He also described Dr. Daniel Ubani, who treated Mr. Gray, as incompetent and highlighted clear weaknesses in the current system of out-of-hours care. Matt Hudson reports now on a damning verdict. Now, there are some flash photography in his report.
It is a diagnosis of health service failings, individual mistakes and lethal incompetence of an out-of-hours service that relied on flying doctors from Germany who treated patients here without proper checks or adequate training, and of a family's loss, a father unlawfully killed on a Saturday afternoon by the doctor called to care for him.
We cannot bring back our father, but the lessons that have been learnt from this awful tragedy are acted upon in a constructive manner, thereby making the provision of healthcare safer for us all. Then, at least, in his legacy, some good will have come from his tragic death.
David Gray died because of this doctor's gross negligence. Daniel Ubani injected him with 100 milligrams of diamorphine, 10 times the recommended dose. Today, the coroner, William Morris, was scathing in his report. Of Dr. Ubani, he said, if he did not know the properties or size of drug he was administering, he should not have administered it. If he had any doubts, I am satisfied he knew he could seek advice. And of the systems which led to Dr. Ubani's appointment, he asked, how was this lamentable situation reached?
The coroner made 11 recommendations designed to prevent tragedies like this happening again. Among them, he said primary care trusts should no longer rely on agencies to select locum doctors. He said they should do that job themselves and that they should have specially trained staff to ensure that the doctors were properly inducted and trained before they started work.
On February the 15th, 2008, Ubani flew to Britain and drove to Take Care Now's Ipswich headquarters, arriving at 6 p.m. He was immediately given induction lectures until about 10 p.m. Ubani then drove to his hotel at Newmarket, but became lost and later told the inquest he got only 3 hours rest. The next morning, he misprescribed Linctus to a patient with severe breathing difficulties. A second patient, Sandra Banks, was taken to hospital after he treated her migraine. At 4 p.m, he arrived at David Gray's home and gave him the overdose of diamorphine. He wasn't stood down until 24 hours later, when it became apparent his actions might have killed a patient. He was told to fly home to Germany.
I'd like to know what was going through his mind, why he's done what he's done, why he's not got the guts to attend the coroner's inquest.
TCN's contract with NHS Cambridgeshire has now been terminated.
We welcome all of the coroner's suggestions and recommendations, and we hope that they will reduce significantly the chances of such a tragedy reoccurring anywhere in England. That's it.
Why did you not take the advice from one of your...
After the tragedy, Dr. Ubani wrote to Mr. Gray's family saying, my nerves were overstretched, I was too tired and lacked concentration, and these factors played a major role in the mistake that occurred. Dr. Ubani, seen here in footage from a charity website, is still practicing in Germany. He was given a fine and suspended sentence by a German court for what happened and refused to return to Britain to give evidence at the inquest. Tonight, the government, which designed the out-of-hours care service, said changes would follow.
What we need to do is make sure that where some PCTs have really done an excellent job, Leeds, for example, rejected Dr. Ubani quite rightly, and then we had other PCTs who just didn't seem to be doing the checks at all, the way they should. So there will be national minimum standards plus greater local involvement by local GPs.
The damning verdict, though, on the mistakes that led to David Gray's death has left profound questions over how a health service that was supposed to care ended up killing. Matthew Hudson, Anglia News, Manea.
So there you have it, today's verdict and the response from the government. But just how did the system of out-of-hours care fail David Gray so tragically and allow, according to the coroner, an incompetent foreign doctor into our health system? David Gray was killed by Dr. Ubani's incompetence, but the system fatally failed him too. Firstly, obvious warning signs were ignored. In 2007, 2 patients were given accidental overdoses of diamorphine by separate doctors working for Take Care Now. Both nearly died. Dr. Christopher Browning, who was in charge of clinical standards at Take Care Now, wrote to colleagues, "If this is repeated and the patient is not resuscitated in time, death could well result." A month later, Mr. Gray was dead. Secondly, why was Daniel Ubani, a German plastic surgeon and GP with insufficient English, able to practice here? In June 2007, Dr. Ubani was turned down by Leeds NHS after failing an English test. But the very next month he successfully applied to Cornwall NHS, which had less stringent language requirements. Ubani could now work anywhere in England and Wales. On his first shift in Cambridgeshire for Take Care Now, his medical induction lasted for less than 2 hours. Rosamond Rhodes-Kemp is a lawyer who specialises in clinical negligence.
I think their whole recruitment process is open to scrutiny. After all, this was someone who flew here without being vetted first, who went straight to work after a long and tiring journey, whose English was not good, and who was not familiar with medical care in the UK.
So then, the systemic failures highlighted in the out-of-hours care which resulted in the unlawful killing of David Gray from here in Manea in Cambridgeshire. Several organisations have been criticised for their part in the tragedy. One of those, NHS Cambridgeshire, the primary care trust that appointed Take Care Now to run its out-of-hours service. Well, I spoke to NHS Cambridgeshire's Chief Executive, Paul Zollinger-Reid, and began by asking him about his own position. Having seen what you've seen so far today, will you resign?
I'd like to start by saying this is a terrible incident, and an incident that should never have happened, and for that we apologise to the family of Mr. Gray. Resigning will not help. I've been in the job 2 weeks. It's easy to blame people. What we need to do here is understand what's a complex situation. And NHS Cambridgeshire has done that. It's got to the bottom of a complex situation. It held Take Care Now to account and terminated their contract. 90% of our GPs are now local GPs who provide our service. And I'm here today to reassure the people of Cambridgeshire that we have in place a high-quality service.
I hear what you're saying, but why should they be reassured? Presumably, when you appointed Take Care Now, you were confident in them. Why should they be reassured now?
I think for the reasons I said about local GPs providing that service, also for the issues about performers list. If Dr. Ubani had tried to get on our list, he'd never have got on. Our standard of English, our requirement is much higher.
The coroner came up with 11 recommendations. Would you add to any of those?
I think the coroners are very comprehensive and very sensible recommendations, and we need to go away, look at the detail of those and see what we can do locally. He didn't make any specific to us, and I think that's because we have actually implemented significant changes over the past 18 months.
This has been a terrible event. It's been a very difficult day for all those involved. What do you feel will come out of this?
What has come out of it for the residents of Cambridgeshire is I am here today reassuring them that we've been down that difficult journey, we've unpicked all the reasons, and we've put in place a very high quality service now. My board take this very seriously, monitor it on a regular basis and ensure that residents of Cambridgeshire have the highest quality service.
Dr. Zollinger-Reid, thank you very much indeed for joining us this evening. Well, listening to that is Stuart Gray, David Gray's son, himself a GP from Worcestershire. Stuart, first of all, just take us through what today's been like.